Hi there. We're doing our casual video today so that you can learn more about Trident Health Family Healing Center and how we treat infections. So this is Amorcita, Ivette, Skolnikov, Zinski, Cake, and I'm Dr. Ilya Skolnikov. Okay. And I did you see the way I grew out some facial hair for you so I knew I was like more human? Like I'm like another one of those people that you'd see just walking up and down the street, kind of like that. Okay, so how do we diagnose and treat infections? There's a lot more to it than you'd think. So the most important part of diagnosing and treating infections is to first get out your glasses that make you look smart.
Okay.
And then you look in the patient's file. Did you want to use this then, or what?
Mm-hmm.
So then we have over the years we figured out there's certain things that work for treating infections and certain things that don't. So we put together a list of foods that are healthy for getting rid of a candida infection specifically, and foods that are unhealthy that bring the candida infection back. Nice. So if you look on our website, tridentofhealth.net, and if you go to the blog and then you type into the search bar candida, you can get this list there, and it's free. It's free. It is. F-R-E-E free. So that's awesome. All right. But that's not the only thing. Then we want to look in the patient's file to see what's going on. Okay, you got all the supplements, the stuff you're taking out.
Mm-hmm.
Okay, and then if their file tells you something interesting, then
Is this Facebook Live?
yeah, no, this isn't Facebook Live. This is just a regular recording.
Okay.
Does that make you feel better?
Yeah.
Okay. No, this isn't Facebook Live, but why do you want to do Facebook Live right now?
Yeah.
Okay. Okay. So anyway, we're going to start to go through and see what's the best approach for Ivette. So the first thing we do is we check these truth serums here. And we also, Ivette gets treated quite a bit because I'm her husband. And, I take this pretty seriously. So we're going to see if she's in a healing state right now. So we go to the high thymus. This is a point that comes from total body modification to check if she's in healing. Here's another one. And there's another one here from Kelly Webb, who's from Texas. She's a doctor from Texas. So she doesn't seem to be in healing at all, so we can do whatever, we can safely treat her without hurting her is what that means. Okay, and then we can check these truth serums. She needs some of that one. So we had a problem in our family. Ivette was exposed to nail polish remover accidentally, and now we're basically helping her with the toxicity of the nail polish remover. So that's the tragedy that took place, literally. And her exposure was for more than a day. It was for a couple of days worth of exposure. Okay, so her eyes have gotten red, and she's had trouble with thinking clearly and all this kind of stuff. So she's had all the symptoms of somebody who's been poisoned. And we've been kind of helping her with herbs, homeopathy, and nutrition, but we didn't do an actual treatment. That we were just treating symptoms with herbs, homeopathy, and nutrition, which doesn't really get to the bottom line. So this is pretty interesting, right? We're looking at an infection, some kind of an infection, that's due to toxicity, because toxicity will weaken the immune system and allow for an opportunity, the toxicity, which in this case was nail polish remover, the main chemical being toluene, will enter the system and wreak havoc. It can cause a weakened immune system, which is more susceptible to infections. It doesn't mean it's going to cause the infection, but it'll cause the immune system to become more susceptible to infection. So she's taking all these different nutrients. Just going to go over them. She's taking St. John's Wort IMT, that's for mood and the brain. She's taking a little bit of Cyst Plus, which is basically to detoxify the liver. It's a protein, it's a sulfur compound. It helps with the sulfation pathway. She's taking Rumaplex, which is for rheumatoid arthritis or joint problems. She's taking Brainfood, which is for, it's Phosphatidyl Serine for the brain. It helps with stress also. And the brain stem, called the, what's the brain stem called? The brain stem area is called the reticular formation, I guess, of the brain stem. I think that's the area, the reticular formation. Okay, and then she's been taking a little bit of iodine, iosol. It's actually not a little bit, there's quite a bit she's been taking of that. And Pau D'Arco for the immune system, and echinacea for the immune system, echinacea, and ginkgo, again for the brain, because the toluene kills brain cells very, 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 very quickly. And also some red clover for hormonal imbalances. So, that's what's been, yeah, it's the reticular formation. That's the area in the midbrain that not the brainstem, but the midbrain that's especially benefited by Phosphatidyl Serine. All right, so we'll check these points, these master points: ileocecal valve, valves of Houston, blood sugar, protein, rib torque. Hey, you don't have any of those. That's good. Actually, let's see if your body's hiding something. So then we're gonna take a special secret sauce. Okay, we'll put that there. And these are vials that have an energetic imprint to them. That's why they call it the secret sauce, because it's secret. Okay. You can learn more about that from The Hidden Messages in Water by Emoto. Okay, so we'll recheck ileocecal valve, valves of Houston, blood sugar, protein, and rib torque. So she's, and rib torque. Breathe. She doesn't like rib torque. Okay. Lie on your back. All those are okay. So she's doing, she's not doing as bad as we're making it sound. And then we're gonna, it's really hard to see this if you're in the audience, but we're gonna turn in the legs and see if they're turning in evenly. I think you might be able to see that. Yeah, they're turning in evenly. Okay, do you see that? Mm-hmm. And then we'll see if the muscles are working. Push up into my hand here, breathing. The muscles aren't working. Or at least that one on the left, that's the psoas muscle. Push up here. That's the psoas muscle. The psoas muscles are related to the kidneys. The main nutrient of the kidneys is water. So it could be that she's not drinking enough water. Maybe. I'm not saying it is, but it's possible. So let's find out if she's drinking enough water. I didn't mean to yell at anybody. Sorry. Can you see me? I didn't mean to yell at you. Sorry. But we'll just see. I think I'm in view here. Go ahead and drink some water and then leave some water in your mouth. I know you have those pills. I gave you the pills, right? So, and then let some water stay in your mouth and don't swallow the water that's in your mouth. Okay, and then go ahead and lie on your back. Just gonna check the view on the camera. Just keep that in your mouth, the water. Yeah, it looks like I was out of view. My hands were out of view. Most of me was in view, I think. Okay. So it probably, it wouldn't hurt her. That's a good water. It's not gonna put her body out of balance. Push up here real hard, breathing. Yeah, this is what happens when you do this for 10 or 10 years or so. People keep doing this for 10 years. Doesn't help to marry somebody that's still going to do it. You could try to promote them, you give them money, it doesn't matter. They're going to still swallow the water. Okay. Go ahead and leave some water in your mouth. Don't swallow that water. Okay. And push up here, breathing. Yeah, so it's not a water problem. up here. Okay? I mean, if you're not understanding this, it's okay, but I can't explain it any better, okay? So the thing, you can swallow the water. The water that we put in her mouth, we thought maybe it's because she doesn't have enough water that these muscles that are related to the kidneys, called the psoas muscles, are weak. The main nutrient of the kidneys being water, but no, that's not, doesn't seem to be exactly what's going on. So let's try to find out what's going on then. Oh, there's one last circuit that we should check. Okay, go ahead and push your leg straight up into my hand here, breathing. Okay, good. And then have a seat facing that way again. Thanks. Uncross your legs. So, do we start here? So we don't start yet. We shouldn't start the treatment yet because her body doesn't seem to want to. See how amazing that is? We have a whole dialogue going on with the person's body. So we have Yvette's inner pharmacy tell us what's wrong. Instead of me trying to understand what's wrong, her body will just tell me what's going on. So that's that makes a lot more sense to me. But rather than just giving her a bunch of drugs and seeing what the drugs do, because I think I'm smart, and the drugs were made in the lab with smart people who probably aren't that smart, because why would you give somebody a drug in the first place unless you didn't know any better. Okay. So we've got A, B, C, D, E, F, G. 1, 2, 3, 4, 5, 9, 10, G10. So it could be anything that's happening. How about your small intestine? Okay. So we're going to go to some points for the, excuse me. We're going to go to some points for the small intestine here. What have we been doing down here? Okay. Sorry. So here's the duodenum, shows up. Here's the ileum. And here's the small intestine. Or I'm sorry, the duodenum, the jejunum, and the ileum. And so she's really having a lot of trouble with her small intestine. So far we're getting all the points showing up. We're going to treat something called DNA system. So we're having our body target the small intestine. Then we do degenerate. We're pinching her a little bit. We're pinching even a little bit. Regenerate. Okay. Then we do eliminate. And then we do regenerate. So breathe in. Breathe normally. And good. And breathe normally. Okay. So we're doing some things. We haven't really started doing the treatment yet. I know it seems like we're doing a lot to not have start doing. You know, the average chiropractor sees their patients for about 5 minutes each. Well, I guess I'm not your average chiropractor because it's already been a few minutes and we haven't even started yet. So let's just try to keep track of the time just to see how much time goes by. Just be interesting that way. Okay. So we can check, is there another organ, gland, teeth, brain, blood, body fluid? Okay, is there another organ involved? Teeth, brain, blood, body fluid, infection. We know you have an infection, I get that, that's helpful. So we're going to be helping her with the infection. We're going to be starting the treatment soon. Okay. Let's just, some of the things I'm doing are kind of, I just tell them what I'm doing. I mean, it kind of has to do with like an infection that a lot of people have. It sounds more serious than it is, but is it okay? Because it's common with most people. It's like almost everybody has these kind of infections. Mm-hmm. It's all right? Mm-hmm. Okay, so I got it. Mm-hmm. So basically what's happening is most people have cancer cells in their body and then, you know, nobody's really diagnosing it, and then all of a sudden they go to one day, you know, a person might have more cancer cells and they get really, really sick, and then they go to their doctor and the doctor does a bunch of labs, and they finally figure out, okay, wow, you have, some kind of cancer, like colon cancer, lung cancer, or prostate cancer, uterine cancer, whatever. It could be some other part of the body. And everybody freaks out, and then they start getting, irradiated. They have no idea what to do about it. They don't know how the cancer got there. They don't know how to get rid of the cancer. They don't know how to get the cancer from coming back once they do get rid of the cancer. Or they say, oh, we have a cure. We're just going to use this chemotherapy, which is really, really toxic, and which is the same thing that causes the cancer to begin with, is toxicity. So I'm not trying to be extremely disrespectful, but they're definitely kind of out of their minds, because this is not a smart way of doing things. So anyway, we're finding that she's just that exposure to the nail polish that she had. She is, like I said, exposed to nail polish remover pretty consistently for about 2 or 3 days in a row or more. And that exposure, caused all kinds of problems. So, I'm getting cancer of the small intestine. But that doesn't mean that she has cancer of the small intestine. It just means that cancer cells are starting to develop somewhere in that area. So we have to do something about it. So, if I had a regular patient, which Yvette's not, she's my wife. But anyway, if I had a regular patient, I couldn't tell them any of this. All I could do, and I'm not even allowed, my license doesn't allow me to treat cancer. I can't do any of this stuff, right? So the only thing I can do is basically help them, right? I can help people. So, if you or somebody has some problem like this, like cancer or something like that, it doesn't mean I can cure them or help them at all. But I can always do I can do the exam and find out what's wrong and see if the therapies we do in the office can help. And if we can help figure out what caused the cancer and get rid of the cause of it, then hallelujah! That's the whole point, right? Is not to have to get chopped up, irradiated, or given some kind of chemotherapy, right? I mean, that should be the point, in case I'm not trying to be rude, but you should know that that's the best way to go, right? You're being brainwashed by the stuff on TV and all these Kaiser and all these crazy, huge cancer organizations. Susan G. Komen's Walk for the Cure. Give me a break. Who do you think sponsors those Walk for the Cures? I mean, they'll have Diet Pepsi, the Coca-Cola company. They'll have all these companies that basically contribute to the cause of cancer sponsoring these Susan G. Komen's Walk for the Cure that allows the cancer to get there to begin with. So it's a bunch of nutty things. Anyway, this is just kind of to remind me where we're going, because we haven't started the treatment yet. But go ahead and hold that there. Yeah, so at some point we'll start the treatment. So anyway, that's what we're dealing with right now for this treatment today. So do we begin with the infection? No. Okay. We're not going to begin with the infection. We're not even beginning yet. Soon we will begin the treatment. Okay, breathe in and breathe out. Okay. So there could be cancer cells, there could be pre-cancer cells, there could be a focal infection. That's really, really popular these days in complementary and alternative medicine. Holistic medicine, we like to talk about focal infections, the most common being caused by tooth infections that people have, where they have a root canal, and then that leads to a cancer that develops, a very small one, and that leads to problems throughout the body, and then they have, nobody's diagnosing it, nobody's noticing that it's there, because it's so tricky, it's not an obvious thing. These are just a few that, there's different kinds of metastasis, right? The cancer can travel through the body, and different kinds of cancers are different. Some are more aggressive than others. And again, my license doesn't even allow me to really, I don't treat the cancers, I just figure out how they got there, and then people seem to get better, which seems a lot smarter to me. So let's figure out where we're going to start. Put a hand on your forehead, that one, yeah. And then take the hand away. We could see if there's some kind of emotion that we want to deal with. Maybe there's not. Shame came up, Ivette. Are you able to get in touch with the feelings of shame? Mm-hmm. Okay. So, humans have emotions. That's kind of straightforward. So, shame. Okay, so she gets weak when she when I just say the word shame, or she thinks about shame, and we want to not have that happen. Okay, so is this where we start? But we're not starting yet. Okay, this doesn't seem to be where we start, but at least we're going to help her with that, which is nice. Okay, so where do we start? Primary homeopathic remedy, flower essence, herb. Should we start with more muscle tests? Let's do a few more muscle tests and see what we're going to do. Go ahead and line your back. We got started with a couple of them. Here we go with some more. Muscle tests! Oh, this is so much fun. Okay, here, let me show you what the muscle tests are about, if you're watching this. So we checked the psoas muscles, and they were, today's the 26th, right, Ivette? Today is November 26th. So we checked the psoas muscles, they weren't working. Push up here, and they're still not working. Okay. Now we'll check the gluteus medius, push up, whoops, hey, keep your legs low, and then push out. And push out here. Okay. Push your legs together. The gluteus medius muscles are related to the climacteric, push your legs together, which is related to basically the hormonal system. Okay, we can turn the heat on again. You can talk if you want to. Hey, you don't have water there. Yeah, I know. Okay. Sorry to have my back to you. Okay, push your legs together here. Okay. So, is this where we start? Now we start. Actually, let's push out here. Hold on. Push. Okay, now we'll start. Okay, have a seat facing that way again. That way again. Okay. Sorry to have my back to you guys. Breathe in and out. Yeah, hold on. Recess. Okay, relax a little bit. Just leave the pills there. People hate these truth serum pills. They don't want to tell the truth. They don't want to have. They don't want to have the pills in their mouth. Okay. She's just being polite. They actually taste pretty bad. A little bit like dog food or something. Okay, so organ, gland, should we start with the infection? Okay, should we go to the master points? So we'll go to some master points. How are we going to treat Amorcita's infection? We're going to treat it very well. Yvette's name is Amorcita. Okay. So we'll try to make it interesting for you guys watching. This is one of the old ones, huh?
I guess so.
Master switching. There's another one. You have all the things you have here. So let's get the new one. Okay, so we'll check red. What color's Ivette wearing? She's wearing red. Think about sex. Okay, we don't want Ivette getting weak when she thinks about sex, so that's not what we want, because that's not what we want. Okay. Breathe. That's not what I want either. Okay, breathe.
Explain this color is related with the...
This color is related to the first chakra. Breathe. The first chakra is related to sex, power, and money. Okay, breathe some more. Think about sex. Okay, she's okay with that now. So that's an energetic body. So red, orange. It's almost like an orange. Now you're wearing a red. Okay, we'll put that one on.
Yeah.
Sort of orange. Okay, Bono. Think about your family. We don't want Amorosita Ivette getting weak when she thinks about her family. Okay? So this is the second chakra. Breathe, breathe. Good. Think about your family. Now she's okay when she thinks about her family. So it's like a biofeedback mechanism, right? Weak, strong, like a binary system, sort of. Yeah. Okay, if you're a scientist, you'll love this. If you're not, then maybe this isn't that interesting, but okay, red, orange, yellow. Okay. Let's see. Do you know what I mean when I say think about balancing your needs with the needs of other people?
Oh, yes. Yes.
Okay, think about, yeah. Okay, think about balancing your needs with the needs of other people. Okay, she gets weak thinking about how to balance what she gives with what she receives. Okay, breathe, breathe. Think about balancing your needs with the needs of other people. Ready? Red, orange, yellow. Red, orange, yellow, green. We'll check green just in case. What? I'm just looking at the camera. Go ahead and put those on. Green is related to the heart and the liver, a little bit like the liver. Okay, so she's all right with green. Green, blue, indigo, violet. Okay, do we need to use glasses some more? Okay. Okay, this is a point called doubt for people who are having doubts. I'm helping with doubt. We're doing elimination system. We're eliminating the doubt from her system. We're just going to get rid of the doubt. When in doubt, get rid of the doubt. Take it out. When in doubt, take it out. Now we're going to regenerate her system to help her to recover from the lost doubt, which maybe she's missing. I don't really know. Breathe, breathe. Okay, so that helps regenerate. Now she goes into a quick healing state for just a couple minutes or less, and then we continue. Okay. Organ, yeah, so the doubt's gone. It's not there right now. We can check if there's doubt in an organ, gland, teeth, brain. Organ, gland, teeth, brain. So there's a little doubt in her brain. So how do we help with that? Flower essences. We can help with brain doubt. Doubt in the brain with flower essences. There's a brain. Hold that there. Doubt in the brain. Rose of Sharon. Okay, we'll put that under your tongue. So we're giving her Rose of Sharon. Okay. Down in the brain. Eliminate, regenerate. She doesn't need to eliminate or regenerate down in the brain because the flower essences helped the Rose of Sharon. Rose of Sharon, can I just go talk to them?
Sure.
Thanks. So Rose of Sharon is for... Rose of Sharon is for those who have had distant mothers.
Yes.
It's always real accurate, by the way. It's for those who have had distant mothers. This essence is soothing and comforting and heals wounding, which has caused mistrust, a useful remedy for sleep disturbances. Have you ever had a sleep disturbance before?
Yes.
Okay. Okay, I'll just put it back there. teeth, brain, blood. Do we need to look at infection? Do we need to deal with infection now? Is infection now a priority? Okay, what kind of problem we got? So we've got bacterial, viral, targeting in the brain, just to see if the brain needs any help with anything. DNA system, degenerate. So we're helping to regenerate the brain and eliminate any kind of brain dysfunction that way by rubbing there. Then we're letting her body know what we're doing, and then we're seeing if we need to eliminate anything else, generate the brain, and get rid of whatever damn virus is there, excuse my language. But you know, it's YouTube, we can swear on YouTube, what the fuck. Even if you're a doctor, you can do it? No? I'm not sure if I should do that because I'm a doctor. Sorry, I take it back. We're going to help get rid of the problem with the virus that may or may not be in the brain. So breathe. Okay, and then she's healing from that, and then we'll give her a minute to heal. How's the healing? It's going good. Okay. So any feelings of shame? Feel those feelings of shame? Okay. Is there any other organ or gland besides the brain? Organ, gland, teeth, blood, body fluid, infection. Okay, so it could be bacterial. It could be an alternate virus. It could be mold, fungus, candida. Okay, we got mold, sorry to say. Best way to help with that would be to eliminate the mold. We're eliminating mold. This way, see? We're eliminating mold. Okay. More mold. Okay. Okay. Then we're going to regenerate after the elimination of the mold. Okay. Breathe in. Breathe normally. Okay. I'm pulling and resist. She goes into a bit of a healing from that. Okay, and we just went through with you all this great stuff about the mold yeast candida diet, right? Mold yeast candida, mold yeast fungus candida. So there's a diet on my website. If you've been watching the whole video, you would know from the beginning part that there's an easy way to get to that and have access to that. That doesn't mean that this is the silver bullet for all your mold yeast fungus and candida health concerns. All it means is that we help people with that in our office, and we have a system to do so with. And you could certainly get some value from that, right? It has value for sure, especially if you've been dealing with these kind of infections for a while. But we don't just do a one-sided approach. We're doing what's called the triad of health. So we're doing structural, chemical, and emotional therapies. We're not just doing change your diet therapies. We're doing the chiropractic adjustments. We didn't do any. But anyway, we're doing chiropractic adjustments, and we're doing the balancing the traditional Chinese medicine acupuncture meridians. We're doing a lot of things. So. The candida can be anywhere. It's not necessarily just in the vagina or just in the lungs or just in the digestive tract. It can be anywhere. Yeah. In this case, we're finding it in the brain, right, with Ivette. And in the small intestine. So any other organ with candida, any other gland, any other problems with is the teeth, blood, body fluid, bones. Okay. Are we finished with the brain? Are we finished with the virus? Actually, we were treating more for a virus, but also candida. Okay, we're finished. She's had a lot of treatments in the past. Vaccinations. Do you need to consider vaccinations? Heavy metals? I guess not. So we finished with shame, right? We did the shame?
Yes.
So we did the shame. So that's good. Chiropractic adjustments we need to do, homeopathic remedies, other flower essences, any kind of herbs, nutrition. So lie on your back and let's just see what happened. So, what happened? Okay. So, okay. Push up here real hard, breathing. So this muscle's still weak. Push up here. Yeah. Okay, so it's still weak. We're dealing with energetic bodies. We're dealing with Tao. We're dealing with the biocomputer. There was no bacteria. We found a virus. We found mold. So we're going through a whole sort of like a system. And today is the 26th. Okay, I guess we're not done. Okay, go ahead and have a seat facing that way. Parasite. Okay. Eliminate. Regenerate. Now we're helping her with a breathe in with a parasite. Pull in, you resist, and relax. So is it still in an organ, gland, teeth, brain, blood, body fluid? Do we need to use a flower essence? So she needs a flower essence to help her to get rid of this parasite. Why? I have no idea why. I just know that that's what her body just said. She needs a flower essence. So we have some really great ones that we can choose from. This one's called Sweet Pepper Bush. We'll see what it's for. Put that under your tongue. Okay, I'll tell them what it's for. So Sweet Pepper Bush is for this essence strengthens our vertical connection, freeing us from horizontal entanglements. This is a superb remedy for anxiety and is a softener, excellent for releasing hardened emotions. Used for compressed emotional conditions such as tension and hardness for those who feel they are carrying an emotional burden. It assists one to change their viewpoint and recover their emotional center. A remedy to ease struggle for those gnawing on their problems like a dog on a bone. Okay, so that's a good one. These flower essences come from Essence Alchemy, a friend of mine in Southern California who has a really great, real talented fellow who puts together these amazing flower essences. Okay, to help with the, what are we helping with anyway? The parasite, right? To help with the parasite, just take out the parasite. Parasite right here. Okay, to help with the parasite, do we need to use any other flower essences, homeopathy, nutritional supplements, herbs? We might need to use some herbs. Pau D'Arco, for example. I got it. Okay. So we already have an herb. There's water here. Okay. So we want to make sure that I know what I'm doing. Ivette feels comfortable with what we're doing. You guys are feeling comfortable with using your time watching this video, right? Go ahead and lie your back, please. So we'll put some of this on your tongue, the Pau D'Arco. Don't expect it, you already know it tastes kind of funny. And we'll see if that helps with the psoas muscles, tongue. You got a lot on her tongue. Most people don't like that. May not help, but let's find out. So push up here. Breathing. That muscle's working great all of a sudden. Hasn't been working at all before now. Push up here real hard. And that muscle's working great. Actually, it's working much better than I thought it would. Okay. Push up here. Breathe. Eyes open. Yeah. Okay. So, hey! So what does that mean? It means we're not really having a problem with water metabolism per se. We're not necessarily having a problem with not drinking enough water. We're not having a problem with drinking the wrong kind of water. We're not having a problem with not drinking water often enough. We're not really having a water problem that's causing trouble with the psoas muscles that are related to the kidneys, the main nutrient of the kidneys being water. Sorry. The main trouble that we're having is an infection in the kidneys, right? Right, okay. Have a seat facing that way. You still have the pills under your tongue? That was the right answer, okay. So let's see about that. So we'll kind of hone in on her kidneys. We got vials for all these different things. At least we're supposed to. What vial did we take out? Small intestine. We got small intestine. So kidneys should be around here somewhere. Kidneys. Okay. Maybe bladder too. Okay, in fact I have a special vial for urinary tract infections. And urinary tract infections, especially bladder infections, are related to the emotions. Dun, 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 dun. They're related to fear, paralyzed will, comme ci, comme ça. They're related to miffed, timid, inefficient, wishy-washy, dread, bad memories, contemplated, and impending doom. So let's take a kidney, any kidney, there's one. Put that hand on your forehead. Okay, take the hand away. Is it related to one of these? Paralyzed will, miffed, timid, inefficient, wishy-washy, comme ci, comme ça. Fear, dread, bad memory. Present time, obviously, but prior to conception, conception to birth. Could your mom have had any kind of bad memories when she was pregnant with you? Or experiences?
Yes.
Yeah. Think about whatever bad memories your mom had when she was pregnant with you. Okay. So bad memory. Okay. So there's three main things in life. There's love. That's one of the three. And then there's money. Okay, and then there's your roles in life. Okay, so money's, these are real, all three are common. So we've got money. Right here, hold that there, put it up to here, hold it up to there. And she gets weak just looking at and touching a little bit of money. Or actually, it's a couple $100, but you get the idea. So, and that would be the red glasses. Kidneys are the red glasses. The colon and the kidneys are the red glasses. Okay. So we already found conception to birth, bad memory, and and then money. So speaking of which, this change is bothering me a little bit. Okay, so what are we gonna do about it? What do we do about the bad memory that the mom had and now is present times something, Think about what happened in Honduras when you had the pharmacy. Think about what happened when your mom was giving you a hard time and Graciela said it's not my fault, it's Yvette's fault. Think about, so there's actually quite a few bad memories. There's not just like one bad memory, okay? So we want to help with all of them. How are we going to do that? What are we going to do? Oh my God, I don't know. What are we going to do? What are we going to do? Okay, let's find out what to do. Okay. Should we go with the vials? Sure, we could do the vials. We've got personalities, feelings, love, sleep, love, So we're doing energy medicine. We're doing vibrational medicine right now. It's energetic. So all esteem. We want to help you with esteem. Best way to fix. Flower essences. So maybe helping her with her esteem will help with the bad memory. Maybe it won't. And meanwhile, let's not forget about the infection. White morning glory. We'll put that under your tongue. Okay, white morning glory. Excuse me. White morning glory is for treating deep fears from the past and fear of facing repressed parts of the self. This essence helps restore peace to the nervous system disrupted by deep fears. Unprocessed, what are we dealing with? Fear, right? It's similar. We're dealing with a bad memory, which is basically like that's caused fear, right? Unprocessed, repressed fear has a legacy in the nervous system and neural pathways. This essence helps release early childhood fears so we can awaken to a new life beyond fear, darkness, and cynicism. This is a remedy for balance and integration in fears which have a disrupted vitality. This is deep stuff. We're doing deep emotional, spiritual, mental therapies. Wow, I'm gonna have to cough for that. Excuse me. Okay, so we're doing this deep stuff. Deep is getting deep, folks. When you're trying to find out what kind of healthcare provider to go to because you're like trying to choose from among 5 or 10 different healthcare providers, or maybe 2 or 3, always choose the one that does deep work. That's what you want to do. You want to choose deep therapies so they can get down deep into the causes of your health concerns so you don't have to have them anymore. God forbid you walk around unhealthy and on lots of medications the way many of us are. Okay. So we're going to take a look at any poisons there may be. There's a lot. They keep coming in and going out. Okay, so we're going to eliminate the poisons. I don't do this with all my patients. This is more of like a show just for you guys. Okay. This is not a really, this is, again, Ivette is my wife, so it's a little different. We're going to really eliminate the poisons. Okay. And then we want to regenerate after all that eliminating. Breathe in. Breathe normally. Okay. And while we eliminate the poisons, we're eliminating the infection of the kidneys and we're eliminating the the infection of the kidneys and the esteem. We're helping her with her self-esteem. How is that possible? How could he really be doing all that? I don't know if I believe in this mumbo jumbo. That's fine. If you don't believe in it, just go back to Kaiser and get your prescription for your blood pressure medication. No problem. You don't need to watch this video. I mean, but if you want an alternative and you want to get away from that crazy stuff, here's an alternative. You were wondering what it looked like? You were looking for something different? You were looking for something that was effective and efficient, that was cost effective, that where you could afford it, where we have financing and you could get better quickly and stay feeling better. This was what works. This is well documented. Again, take a look at some of the literature. Emoto's work, the many hidden messages in water, and all the other things about water. You're not sick, you're thirsty, by the Indian medical doctor. He talks about how most people are just dehydrated and then they give them medications for dehydration. It's crazy stuff. Okay, so let's see how we're doing. Organs, other organs that have the infection, glands that have the infection, teeth, brain, blood, body fluid, finished. Okay, I think we're. Okay, breathe in. Yeah, I think we're pretty normally. I think we're pretty good with that infection. It seemed like I was getting angry. Hey, it's frustrating. You know, I'm up against, you know, billions and billions of dollars and in advertising, and then, you know, a family chiropractor doesn't have a lot of money to advertise, and even the whole chiropractic profession, you know, we charge a reasonable fee. The average chiropractor charges $60, $70 or less per visit, and then, you know, we're not making on average $275,000 a year the way you know, a successful surgeon does or something. But we're, you know, I'm able to help people to no longer need many of these surgeries with the therapies that we do. It's not a claim. I'm letting you know what's happened over the last 10 years. I'm not saying it would happen to you in this office. I'm just letting you know what's happened with many of my other patients. So we were just checking organs, glands, teeth, brain, blood, body fluids, and then we did the clearing the biocomputer, and I think we're pretty good with that. Any other flower essences, any other kind of homeopathy, any kind of chiropractic adjustment? I guess not those things, right? Okay. I don't know that we need to lie on your back for a minute, and let's just see what's going on. Ready? Hands by your sides? Okay. Push up here. Breathing. You know, she's kind of out there. When I say that, I mean she's processing what we're doing. You're feeling a little tired now? Okay. Push up here. Yeah, so she actually has gone into like a healing state where all of her muscles are starting to shut off. So that's what's happening now. So as you remember before, I could give her the Pau D'Arco and it would strengthen that muscle. So we can try that, but I'm under the impression, just because, you know, again, I've done this for about 10 years, I'm not trying to sound egotistical, just after doing something for a while, you kind of learn how the thing that you do works. You know, if you wait tables for a living, you kind of know when somebody wants more water at their table, and you can go and, you know, get them water if you wait tables. I don't wait tables, but I do this stuff. Okay, try this again. Yeah. So we'll try putting the Pau D'Arco on her tongue and see if that does anything. Alright. So here comes, yeah, and I have more water for you. Let me get more water for her just in case, because it smells good, but it doesn't really taste that good. It's tasting like, oh, we gotta bring the water. Oh, you brought the water in the other day? For the patients?
Yes.
Okay, great. We give our patients free water because people often don't drink enough water, and we want to help you to hydrate. So sometimes patients will get free water to help with that. Okay. Let's try it out. So we'll put some of that on your tongue, on top of your tongue. Okay. You taste it in there, Ivette? Okay. So yeah, I don't think this is going to do it. I think she's in that healing state. Push up here. Yeah, so maybe we'll, in a minute, might stop the video because there's not a lot more we can do. Well, we can do the herbs. Push up here. We'll check for herbs, homeopathy, nutrition. So we did the treatment. We did a bunch of emotional therapies. We did a bunch of, oh, here, I got it. We did a bunch of emotional therapies. We did a bunch of muscle tests. You could think of that as being the structure of the body. We did a lot of mental kind of therapies, and we did some spiritual things. Okay, we dealt with infections successfully. Maybe you didn't notice, but the muscles got strong, and then she went into a healing state. So we've done a lot, and now we're just finishing up. We're going to check to see if she needs any herbs, homeopathy, nutrition, or lifestyle changes. So far, she has lots of lifestyle changes she's been doing. The main one being going to a tanning salon 3 times a week. So every other day, she's been going to a tanning salon to help with mood. And what about the St. John's wort in the little pill case? Do you have that here?
I put it in that one.
Oh.
Mm-hmm.
That's all you have left?
No, I have no at home.
But the pill case is at home?
Yes.
Okay. Okay. There you go. Okay, bring that up here and look at the money. Okay. Okay, so she's not getting weak with money now, which is good. I'll just put it away. And self-esteem, we didn't, we just treated all that self-esteem stuff. Okay. So she is going into a healing state, but it doesn't mean we can't do a few more things. It just means I have to think about it more. Can we get permission to continue the treatment? Okay. Is there any stipulations that are necessary for continuing the treatment? Weak is yes. No, we can just continue for a while. Okay, so we took care of the parasite, organ gland teeth, but not finished. Alternate parasite, organ gland finished. No alternate parasite. Mycoplasma. You have a little mycoplasma. Hold that there. Okay. Best way to fix NET. Okay, is this a priority? Okay, so we're going to do a little emotional therapy. There's 3 things in life. Love is one of them. There's 3 kinds of love. Family love. When it comes to family love, there's just family love. There's nothing else. There's just family love. Okay. Okay, so we found that family love is coming up. We're trying to find an emotion. Is it earth? Is it metal? Is it water? With family love, what is it? Dark pain. So it comes up as dark pain when it comes to family love. Are you able to get in touch with that feeling? Okay, feelings of dark pain. So we just write on our paper. We already finished with the bad memory and money, didn't we, or not?
Yeah, bad memories.
I don't know if we finished that or not. Okay. So family love, dark pain. Okay, let's go back to the bad memory. Okay. Feel the feelings of bad memory your mom would have had when she was pregnant with you, whatever those bad memories were. Good. And then the bad memory now, in the present time. Okay, and especially if the bad memory relates to money. There's things that happened in Honduras and whatnot. Okay, remember in Honduras? Okay. Yeah, so we took care of the bad memory with money. Yay! We took care of shame, bad memory with money. Now we're dealing with dark pain. Was there when it comes to family love, was there an earlier time there was a similar feeling of dark pain prior to conception of birth? Okay, could your mom have had any dark pains when she was pregnant with you?
Could be. Could be, yes.
Was she ever treated poorly by any human?
She was dealing with some, yeah.
Dark pains, okay. Think of that and how that would have affected you as the little unborn baby inside her up until the time that the umbilical cord was cut. Okay. So we'll help with that then. Best way to fix is we can't do a chiropractic adjustment, so we will not do that. Flower essences. Use flower essences. So we're helping some more with the bladder, the kidneys. That's what we're doing right now. Dark pain is a bladder related emotion. Okay. Okay, Confederate violet. your tongue. Okay, just let that sit there. Excuse me, I'm just gonna. Okay, Confederate violet is for enhancing one's sense of personal safety, good for sensitive individuals. One feels protected and safe. Do you ever feel like you're a little bit sensitive to certain things? Okay. Useful for individuals who were brought up in an insensitive family or community and suffer apprehension. This essence addresses related trauma. That sounds good. Okay. So, you get your flowers. We've taken care of a bunch of poisons, right? We'll check toxins. See if we can eliminate a bunch of toxins. That's what we're doing right now. Get out of there, toxins. Eliminate the toxins. And then we regenerate. Okay, breathe in. Okay, good. So we're regenerating after having eliminated the toxins. We dealt with poisons earlier. Just kind of relax a little. This is fun! Helping people with their health is supposed to be fun. It's not supposed to be a big drama, disaster thing on TV where all the family members come in and they say that somebody's like in the hospital and they can't think straight and they're hooked up to an IV. That's not what's supposed to happen. You're supposed to live till you're like 90, 94 as a male, and then you die. And then as a female, you live longer, 107, 110. Okay? And then you die. You're not supposed to have all the drama. It's supposed to be a good life, mostly, with ups and downs.
So you are feeling how my body responds, how my muscles respond every time you put in? With the muscle testing?
Yeah, I'm just feeling, is it strong or is it weak? They don't,
Okay.
they just, yeah.
Just bring them.
They're not, okay. So, let's say the muscle, okay, so if I pull down on her arm and the muscle stays strong, that just means that she didn't injure her shoulder so bad that she's not able to resist me pulling down. That doesn't really mean anything, really, right? And then if I pull down on her arm and the arm goes weak, obviously that means she hurt her shoulder, right? Okay, but we can get more insight into the body. Say my name is Ivette.
My name is Ivette.
And her arm stays strong. Say my name is Samuel.
My name is Samuel.
Okay, she gets weak because she knows her name isn't Samuel. So then we can get deeper into the body and a person's consciousness.
Okay.
And since we're near the end of the treatment, she should be strong with most positive affirmations. We'll do. I'll have you do the talk. We're both gonna have to talk. How many do you want to do? 2, 3, 5, 6, 8, 10? How many do you want to do?
Just 2.
We'll just do a couple of these. Okay. I want to get well and stay well.
I'm gonna stay well and get well.
Okay. I want to have a good life.
I wanna have a good life.
Okay. God is good.
God is good.
I love myself.
I love myself.
I'm in charge of my life.
I'm in charge of my life.
You guys got an extra 3 or 4 extra ones for free. Okay. So we didn't just do 2. Let's say, and then she should weaken to a negative thought or a negative statement, right? So say God is evil.
God is evil.
She should get weak to that. It shouldn't be strong. If it was strong, that would be something called psychological reversal. Say, I want to be sick.
I want to be sick.
She should get weak to saying I want to be sick. But if she says I want to be healthy,
I want to be healthy.
she's getting strong, which is good. We want that. So most people are reversed. Most people, when you have them say, I want to be sick, they test strong. And then when they say, I want to be healthy, they test weak. So that's not so good. So we have to change all that around for those people. Okay. So, thanks, Ivette. So, like I said, we're not really quite finished. We're just getting to that point. The other kind of herbs, and we have the allopathic nutrition, flower essences. So we finished with your family love and dark pain, or not?
Yes.
You felt the feelings of dark pain that your mom would have had when she was pregnant with you a long time ago, and the dark pain now when it comes to your family. Feel that feeling when it comes to your family present time. Wait, present time, family, dark pain. No, actually, we're not done with that. Flower essences. Good thing we checked it, right? Okay. Okay, Asiatic dayflower. You kind of look a little Asian, kind of just the eyes. Okay, we'll put that under your tongue. Okay. But yeah, maybe. She's Mayan, Yvette's Mayan. So let that stay there for 30 or 40 seconds. Okay, Asiatic dayflower is for okay, it's for for balance by instilling peace. This essence connects the brow and belly chakras. So it's connecting the indigo chakra, which is the brain, which is thinking. It also has to do with the past and the future, and we're dealing with a lot of past stuff. And the belly chakra is basically the family, right? So we're talking about the family in the brain.
Orange.
Yeah, the orange. Okay, so it connects the belly and brow chakras and helps one to be more present with life. It helps us move forward with greater ease, especially when there is busyness or a tendency to be pulled off center. It addresses the unconscious part of us that keeps us overextended and out of balance. All right, yeah, that's good. Okay, feel the feelings of dark pain when it comes to family love in the present time. Okay, good. And if that were to weaken, then we would just go and figure out what the next thing is that would help it to be strong, right? It wouldn't be like a big deal. It just means she's not finished with that. Like why not just talk to the patient's body instead of doing like 15 labs for $3,900? Why not just get some training, do some quick biofeedback testing, and get information quickly instead of having to go through all this craziness that you and my friends and family and myself are going through when we end up going through the the medical system that we have, the Western medical system, right, which is allopathic medicine. Okay. So I think we're pretty good with this. Just one more time. Is there anything in the organ, gland, teeth, brain, blood, body fluid, somewhere else that the mycoplasma's traveled? We're finished with the mycoplasma. Okay, glad to hear about that. Glad to hear. Mycoplasma is an infection. It's when bacteria mutates and it starts to become a mold. It's kind of like the in-between infective agent between mold and bacteria. It's called mycoplasma. So that's what mycoplasma is. Check spirochete. Okay. Amoeba. Okay. Sorry. Amoeba. Amoeba's good. Alternate virus. Okay. Alternate virus. Alternate parasite. Okay. Master mutation. White blood cells. Okay. Eliminate troubles with the white blood cells. Okay. And regenerate. Okay. Breathe in. Breathe in deep. Good. Okay, I'm pulling you resist. Maybe walk around a little bit. So we like to have people walk to integrate what we're doing to help them. Now it's starting to get late. It's like 9:45 p.m. we need to eat dinner. We need to eat regularly to balance our blood sugar. Okay, so as she walks around, she's gonna stimulate the nerves in her feet and the joints of her toes and feet to bring the information from that stimulation back up to her brain, which then helps her body know where it is in space, and it helps to integrate everything we're doing. The gait of man is the fate of man. So when people have trouble with walking, a lot of times they have all kinds of problems. Okay? Okay, go ahead and have a seat there. Okay, we'll check that out. Organ, gland, teeth, body, brain, body fluid, finished. White blood cells. I'm a little tired, huh? Ready? Breathe. Okay, do we need to stop the treatment? Can we do anything else at all besides checking herbs, homeopathy, and nutrition? Okay, I think she's about done, folks. So yeah, if you overtreat somebody, it can not be so great. But I'm not teaching you how to do this. I'm just demonstrating what I do to help people. So I didn't get a nosode. Let's just check well, I don't know if your body will let us check. Can we check master immune? We can check that. So 3 fingers to the thymus. That's okay. I'm putting 5 fingers here. Usually I just have the patient put their 5 fingers there. But, we got married and everything. So, okay, good. So let's just, so now we can go back over her different nutrients she's taking to see if she still needs to take them. So we totally finished with the dark pain. We're good, right? With dark pain. Yes. What about the little piece of paper with all your supplements on it?
No, I bring it.
Where's the piece of
I can
paper?
see it.
Okay, she's getting a piece of paper. And on that piece of paper it lists all the supplements she's currently using, which is nice because we're checking to see if she still needs them or if she needs more, if she needs less, or whatever. Okay. Okay, cool. Great. Fabulous. Okay, just have a seat. Okay. And then I always wanted to help with everything. Okay, so we're just going to recheck this real quick. So the cancer cells we found earlier, we're just checking if there's anything left that her body doesn't know how to deal with. Any other organ, gland, teeth that it went to, brain, blood, body fluid, other infections that need to be found out about. Flower essences, homeopathy. So it's not done. We're not done with it. You gotta ask, otherwise you don't get the information. You have to ask, otherwise you don't get the information. So let's find out about that. Is your arm okay?
Mm-hmm. Yes.
Okay. Cigarette smoke. Is that nail polish remover really caused her a lot of problems with her lungs? So we're helping her now with her lungs. I guess this is called Fumi cigarettes. You're showing me where it is?
No.
Fumi cigaretti. Yeah, Fumi cigaretti. Okay, F-U-M. So it's not just the small intestine. It's not just the brain. It's not just the kidneys. It's also the lungs. One on the right. One on the left. Both lungs. bronchi, 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 bronchitrachea, bronchitrachea, bronchitrachea. DNA system, degenerate, regenerate, eliminate, regenerate. Breathe in. And pulling and resist. Okay, we're going to wait a minute because she's processing that, what I just did. I just treated her lungs, her bronchi, and her bronchitrachea. So the kind of right the throat area, right? The whole area from the throat to the bronchi to the bronchioles to the acini of the lungs, all the lungs and everything. You ready?
Mm-hmm.
Okay, your arms okay? So, breathe more. So she still needs the remedy. So we'll give her the remedy. Avoid mint for a few days as if you haven't already been doing that. Okay, we'll put that under your tongue. Okay. It's just the stuff's trying to come out, Ivette. That's what it is. So, okay. So let's just see. I mean, our body doesn't, we just got to see if there's anything left in there. I gave you 10 M. This is 1 M. Put that under your tongue. This is 200C. You might have a cough for a day or something. That's part of the treatment.
Okay.
Please don't use the nail polish remover. Don't even do it for your nails. It's not.
Sorry.
Yeah, it's not worth it right now. It's okay. I'm not putting it down. I'm just. Okay. Hopefully you guys are getting how valuable this is. The things that causes people's health concerns are the things, you don't need that one, are the things that they're doing. So how are we doing with the lung on the right, lung on the left, bronchi, bronchitrachea. But we haven't drained the poisons and toxins. Switch hands. Switch hands. We haven't drained the poisons and toxins. If you want to switch hands, let me know. You need to switch hands?
Okay.
So we're draining the poisons and toxins. Okay. Now we're going to eliminate them some more, now that we've drained them, because they were stuck in there. Eliminate them some more. Come on, poisons and toxins.
Get out of there.
We're going to eliminate you. We're going to drain you. Okay, no more draining. No more eliminating, just regenerating. Okay, breathe in. around some more. Okay, we've drained the poisons and toxins. We found poisons over here. We found toxins over here. We were draining them here. These are points that relate to those three things: poisons, toxins, and drain. This is coming mainly from total body modification. Total body modification was a technique developed by Dr. Viktor Frankl. Dr. Viktor Frankl used a lot of amazing things that he learned over many, many years. He was a chiropractor. I knew him. He was a good guy. And he passed away about 6 years ago, 7, maybe 5 years ago. Okay. So we've helped her with all these poisons and toxins that came into her system through the nail polish remover she was exposed to. So almost this entire treatment happened because of the nail polish remover that she was exposed to for more than a day. She wasn't just exposed to it once for a minute or two. It was a couple of days worth of exposure. Okay. So let's see. Are there any other organs that have been affected? There are. Okay, is it above the clavicle, below the clavicle? Is it a fire, a metal, a fire, an earth, a metal, a water, a wood? Is it the liver? Okay. I'm just assuming her body's giving me permission to do this. It seems to be okay. Once we figured out she needed that homeopathic remedy called cigarette smoke, is the name of the remedy, or sigaretti, fumi sigaretti. Once we figured out she needed fumi sigaretti, then we ended up kind of going into a whole new window of opportunity for treatment. Breathe in deeply. Oh, that was out. Breathe in deep. Breathe out. Breathe in real slow this time, like yoga. Good. Good faking it. Breathe normally. She doesn't like yoga, apparently. Okay, I'm pulling and resisting. Okay, we'll switch hands.
So I have to avoid mint, right?
Avoid mint. She has to avoid mint for 3 or 4 days because, well, because the mint interferes with homeopathy. A lot of homeopaths, for some reason, they're treating their patients without telling them that. I don't know why, but most of them hopefully are telling their patients that. But there's a lot of strange things going on in healthcare. Any other organ, gland, teeth, brain, blood, body fluid, lymphatic system, interstitial fluid, extrastitial fluid, urine, vaginal fluid, other fluids. Okay, finished. Yeah, we're checking. We haven't even checked her stuff yet. So it's Pau D'Arco. Okay, Pau D'Arco. She doesn't need that. We gotta try to fill it up sometime with something. Hey! Don't be critical. Okay, her St. John's wort that she's been using. She needs that. How much do you have?
The ones that I'm picking.
Yeah, you have like a couple days left, right?
It's just like 2 days.
Yeah, well, we can buy it. I mean, we can order it or something. Okay. So she needs the St. John's wort, I guess. So we'll dose on that. You should put a rubber band around it so it doesn't open up. Okay, so that one's, we're gonna bring all these over here. What happened to the pills that you didn't open yet?
I finished.
I know, but I gave you the whole other bottle. It's okay. Okay, so we have echinacea. She's not gonna need echinacea. So I'll have to work on that. I'm just removing them from the room if we don't need them so they don't get in the way. Okay, Ginkgo. Breathe. doesn't seem to need ginkgo. Huh?
Just there. Just put it in there.
It's a nice one. Why?
You're in the video.
No, I'm in a video. I'm putting the ginkgo back. It's a good video that way. Okay. Like the other ginkgos. She doesn't seem to need the red clover. Okay. She doesn't seem to need the Rumaplex. She doesn't need the isol. Okay, she doesn't need cyst plus, which is for the liver. We went through these at the beginning. Amorcita.
Did
Okay.
you have another one that on Brainfood?
No, I sold those. They're gone.
Sure.
Yes, I'm sure. Thanks, though. Okay, so then we're gonna see, what she does need. She needs the St. John's wort. IMT. And go ahead and uncross your legs. Okay. Breathe, breathe. And you don't seem to need the Brainfood product. Okay? Ivette?
Okay.
Okay. And then we can go through a bunch of things and just figure out if there's anything else she needs just in case. Because it's just a good idea. We've got herbs. You want herbs? We got herbs, folks. Look at those herbs. You don't think that's a lot of herbs? We haven't seen nothing yet. We got more herbs here. See? More herbs. And then over there, we've got more herbs. And we've got books and things of herbs. So we've got herbs, folks. Okay. Herbs from Rosita. You're not eating enough protein. Amorcita, Ivette is not eating enough protein. You're in trouble. Now you're in trouble. You're not eating enough protein. How many protein meals does she need per day? You thought I was gonna find an herb, huh? Okay. 15 protein meals per day? That was a joke. 14? Still joking. 13? I joke around a lot. Okay. Does she need 6 protein meals per day? 5 protein meals per day? 4 protein meals per day. Not 3. 4. Okay. How do you spell protein? Protein. Protein. Tein. Protein meals per day. Okay. Eyes closed for a minute. Eyes open.
We have to taste the Medicons.
Hmm?
The Medicons, I didn't bring it.
Medicare Plus.
Mm-hmm.
Okay. What is Medicare Plus? For all those listening, Medicare Plus is a protein supplement because she's not eating enough protein. So even if you need it, it doesn't do anything. It's just protein.
Okay.
So I mean, I can check it, but I think you need to eat the protein, Ivette. You're not exactly looking overweight, so I wouldn't worry about that part, okay? So if you need it, it doesn't mean anything. It just means you're not eating enough protein. Do you understand? So, yeah, you don't need that. Is it safe to take it every day? 2, 3, 4, 5, 6, 7. Once a week, you can have that without having a problem with it. Okay. It's not going to help you with anything. It's just... I had a feeling. Okay. Okay, so let's see what else. Eyes closed for now. Eyes open. Eyes closed. Eyes open. Okay, so she doesn't need any of this stuff because we did a good treatment. That's a good treatment when you go through and you check and you see what the person needs that you just treated. And if they need like one thing, she does need one thing, but I mean, if they need, she might need more than one thing, I don't know. But if they need one thing, it's a good treatment. If they need 2 or 3 things, it's still a good treatment. If they need 10 or 15 things, that means either they're doing terrible with their lifestyle changes or the healthcare provider who treated them just didn't really, they didn't really do a very good job. Or they don't know what they're doing. I mean, you know, that's possible. Okay, so if you're sitting there wondering why you're taking, you know, handfuls of pills every day when you wake up and when you go to sleep, number one, you have a thyroid condition, I promise you, no offense. Not trying to make you feel bad, I'm just letting you know you do, because it's the thyroid that metabolizes all those nutrients. And number two, whoever's helping you with their health, if there is anyone, they're not really doing an effective, efficient, you know, job of it. So let's just see if there's anything else. Herbs, oops, any other herbs that you need? Homeopathy, allopathic medication, nutrition, standard process, cardiovascular, thorn research. We already been playing around with thorn research, and we found you needed the solvent thing, which they don't make anymore. Okay, so we'll see if there's anything they do make that you need. You okay? Toxic liver. Oh well. Get those chemicals out of there, right, Amorcita? Please don't use the nail polish remover. It's stuck in there. We're gonna have to pull it out with the same stuff we gave you when you were in Honduras. Okay? It's almost the exact same thing. Just okay. And then eat the 4 protein meals, please. Okay. So let's see what you need here. And don't expect to be in a good mood for a little while because you're doing a liver detox. Can you what are you doing there? Just looking at the camera or something? Yeah? Okay. So she'll take St. John's wort 1, 2, 3, 4, 5, 6, 7. I guess you don't have enough for even 2 days. And then you'll take SAT. Without any nail polish remover, without any stuff to clean the floor of the kitchen, without any shampoo that has weird kind of chemicals in it. We'll take 1, 2, 3, 4, 5. Let's write that down. 5. 1, 2, 3, 4, 5. 6. Okay, let's see if there's anything else. It's not really what I was thinking, but okay. So any other herbs? We have the allopathic. Is there any other nutrition? Standard process, cardiovascular, thorn, premium research labs, TPCS, lifestyle. Alright, did your arm hurt?
Yes.
Yeah, kind of herbs, man. The allopathic. How do we do that? Nutrition. You may not need any nutrition besides that. Nutrition. Standard cardiovascular, thorn, premier. Herbs may have the allopathic nutrition. I think we're pretty good. Okay, thank you for coming. It's been a pleasure bringing you this live treatment of Ivette Skolnikov for her nail polish remover poisoning that ended up leading to all kinds of difficulties like an infection and all kinds of things. And we'll see you again on the next video.